Okay. My subject is related to pharmacovigilance in relation to pharmaceutical packaging and labeling. The main objective of my presentation is to speak about the SMPC, or the summary of product characteristics with its safety relationships with the pill or the product information leaflet that contains information for patients and some information on packaging. Just before starting, you know that SMPC is the summary product characteristics in European format, and it corresponding to US product information or US USPI. The summary of product characteristics, it's part of the module 1 of common technical document, which is administrative module that contains the document information such as SMPC, pill, and RMP, for instance, also which provide information to healthcare professionals and to patients. The SMPC, the parent of the SMPC is the internal document within the pharmaceutical company that we call company core data sheet, that includes also the company core safety information. Here we can see in the slide the interdependency between the different sections of the SMPC. The safety related information in SMPC is generally in section 4, clinical particulars, and in section 4.1, therapeutic indications, that corresponds to section 1 in the pill. We can find first of all what is mandatory for medicine that needs additional monitoring. This inverted black triangle we can find now in SMPC with the additional information that will allow quick identification of new safety information and help healthcare professionals to notify any adverse event or reactions. Then in this section, we define the disease and the population for which the benefit-risk balance of the medicine is positive, coming from clinical trials. We need to clearly mention or making the difference between treatment for clinical diagnosis or for prevention, such as vaccine, or diagnosis, diagnostic and indication in case of contrast agent, for instance. An example of in this section may be a restriction to a patient population. This example for a substances or an active substance is indicated for the treatment of chronic hepatitis B in adults with compensated liver disease with evidence of active viral replication persistently elevated with alanine transferase levels and histological evidence active or decompensated liver disease. Then we have a restriction of application. In section 4.2, always in clinical particulars, we need to guide the healthcare professional to pathology recommendation. And we need to mention also the restriction of medical prescription and Also, we can mention any safety need, and we also talk about special populations such as elderly, renal or hepatic impairment population, and we don't have to forget the pediatric population. An example of a specific need in this section could be any recommended restriction to a particular setting should also be stated here. For instance, the mobilization and apheresis procedures. Apheresis procedure, it's the separation of blood plasma from cells, should be performed in collaboration with an oncology hematology center with acceptable experience in this field, and where the monitoring of hematopoietic progenitor cells can be correctly performed. Then we have restriction on how and where and who is intended to administer the medicine. In 4.3, we have the contraindication. Then the cases in which the given drug mustn't be administered for safety reasons. This section should be clear and comprehensive and unambiguous. In such circumstances, that could include a particular diagnosis or concomitant disease or demographic factors that can be also contraindications, or predispositions, or such as immunological factors, genotype, particular genotype, and we an important point to mention that population excluded from clinical trial for safety reasons should be mentioned here. That's a very important point to it. But the lack of data shouldn't lead to a contraindication. Then we need really data to state here. Contraindication in specific population, once again, that's such as elderly, hepatic, or renal impairment, or pediatric, should be cross-referenced in the section giving also related in safety information. An example of contraindication that include a clinical diagnosis or concomitant that can be actually clinical diagnosis of concomitant disease, such as hypersensitivity or demographic factors. An example of a clinical diagnosis is that the active substance mustn't be used to treat patients with severe hypertension with a systolic blood pressure more than 200 millimeter mercury, or diastolic blood pressure more than 110 millimeter mercury on antihypertensive therapy. Then we have here a particular clinical diagnosis. Here in pregnancy, it's so important because everybody knows that the first information of pregnancy comes from preclinical safety data, and what it's important is how to cross reference the information on pregnancy between different sections in the SMPC. For instance, in section 4.3, in this section, it's forbidden to not allowed to administer the drug in second and third trimester of pregnancy. And we have section 4.4 and 4.6. What we can find in section 4.4, which the next section, the precaution and warning and precaution for use. For instance, in pregnancy, angiotensin two receptor antagonists should not be initiated during pregnancy unless it's considered essential. And was advised that patient planning pregnancy should be changed to an alternative antihypertensive treatment for which the safety profile is established. The same information can be cross-referenced in 4.6, which is fertility, pregnancy, and breastfeeding. And what we can find as a statement here that the exposure to angiotensin II receptor antagonist during the second and third trimester is known to induce human phototoxicity. That means decreased renal function or skull ossification, retardation, and neonatal toxicity, renal failure, hypertension. This information comes from section 5.3, the preclinical safety data. And then the advice given here that should exposure to food rate have occurred from the second trimester of pregnancy, ultrasound check of renal function and the skull is recommended. That you see, we have 4 sections in which the same information is cross-referenced. Another example for specific population for which this the drug can be contraindicated. For instance, the drug can be contraindicated in patients unable to receive probenecid, which is a compound to promote increased expression of uric acid and is used to treat gout. Why? And we have in 4.4 precaution and warning for use, that the prevention of nephrotoxicity. What we can find in this section, that how to prevent of nephrotoxicity. Therapy must be accompanied by an administration of oral probenecid and adequate intravenous saline prehydration with each active X dose. Then we warn the healthcare professional about nephrotoxicity. Why? Because the use of active substance without concomitant probenecid has not been clinically investigated. Then once again, the connection between these 2 sections. Now this section is also the special warning and precaution for use. In this section, we need to specify the risk when healthcare professionals have to be warned. And it should be different for each product and therapeutic conditions. Now, there is a relationship also with section 4.8 and desirable effects. Why? Because any adverse reactions described in this section or known to result from conditions mentioned here should also be included in section 4.8. Okay, and this the safety warning should be clear, compelling, and effective. An example of in this section, which is related to serious adverse reactions that the healthcare professional need to be alerted. For instance, infections. We can say that patient must be monitored closely for infections, including tuberculosis, before, during, and after treatment with eggs, because the elimination of the active substance may take up to 6 months, and further treatment with eggs mustn't be given if the patient develops a serious infection or sepsis. Then we state the warning here to draw the attention of healthcare professional in case of occurrence of any infection. And another example with how we detect the noxious conditions, the preliminary signs to any occurrence of an adverse event. For instance, in case of severe vomiting associated to treatment with X, appropriate dose adjustment as recommended in section 4.2 in posology and method of administration must be made. Why? Because some cases were associated with esophageal rupture. Then we have the signs like severe vomiting should alert the healthcare professional in this case, because the possible occurrence of esophageal rupture as stated as adverse reaction in section 4.8. In 4.5, a very critical section, the interaction with other medicinal products and other forms of interactions. This section provides information on the potential of clinically relevant interaction based on pharmacodynamic properties and in vivo pharmacokinetic studies of the medicinal products. And that can lead to recommendations such as contraindication of concomitant use or concomitant use not recommended, depending on the clinical situation. The precaution including dose adjustment, containing mentioning situation where these may be required, such as duration of clinical important interaction and considering that the discontinuation. And this information or such information could be also referenced in section 4.2, 4.3, 4.4, and even for 5.2 as appropriate when necessary. Here we can mention an example that affecting the AUC, the so-called area under the curve, when concomitantly can administer the P-glycoprotein potent inhibitor with cyclosporine with dose of from 200 to 600 milligram, because that increase the Cmax of active substance approximately in this example 2.5-fold, and you see approximately 5-fold. Then we have a cross-reference now in 4.3, the contraindication. What we can see here, that the concomitant use of active substance with cyclosporine, a high potent P-glycoprotein inhibitor, and other P-glycoprotein inhibitors such as quinidine or verapamil is contraindicated. Once again, see section 4.5 here. See section 4.3, and in section 4.5, see section 4 to connect the same information. In section 4.6, that fertility, pregnancy, and lactation. As I said before, it's so important. And now, as everybody knows that within pharmaceutical companies, we have the so-called pregnancy registry to follow up all pregnancy situation and to follow up them until the outcome of the pregnancy, whether it's accompanied with the occurrence of adverse reaction or not. Then, but basically, in this section include clinical studies, information coming from clinical studies and post-marketing surveillance. Pharmacological activity results from non-clinical studies, which is stated in section 5.3, preclinical safety data and knowledge about compounds within the same class. What we mention here is to encourage healthcare professionals to update, to notify all exposure pregnancy to any medicine, because the recommendation for use during pregnancy and lactation are updated within the time. And once again, a cross-reference of with sections like 4.3, 4.4, 4.5, 4.8, and even 5.1, 5.3 could be made as appropriate. Quickly about 4.7, it's the effect of ability to drive and using machines, like the occurrence of dizziness. We need to draw the attention of healthcare professionals as well as patients to use and drive machines. The most important section, we can see that it's a section 4.8, then undesirable effect, and mainly this section is built from clinical trials and post-authorization safety studies and spontaneous reporting, for which, after thorough assessment, like a causal relationship between the medicinal product and the adverse event is at least a reasonable possibility. And based, for example, on their comparative incidence in clinical trial, if the drug is compared to another drug or to placebo, or finding from epidemiological studies, then in phase 4 study, one evaluation of causality from individual case reports, and sometimes, as everybody knows, also that individual case reports could be a signal in some cases. The content of this section should be then justified in the clinical overview of the marketing authorization application based upon a best evidence assessment. As I said, then it's part of module 1, and it's the very important information to provide. Once again, we need to cross reference information in section with the other section, mainly in 4.4. How it's built, this section, we have 3 or 4 main points. We start by the summary of safety profile and the tabulated adverse reactions according to MEDRASOC, and we need to respect the frequency from very common to very rare, and we can also describe some selected adverse reactions, and in case there's a need to talk about pediatric population or other special population. An example of a safety profile regarding the seriousness and the frequency, and here in this example we can find the relationship with the 4.4 and even with risk management, risk minimization measures in the RMP risk management plan. This example, for instance, we have a rare pulmonary undesirable effect, including interstitial pneumonia, pulmonary edema, and pulmonary infiltrates have been reported in some cases with an outcome of respiratory failure or adult respiratory distress syndrome, which may be fatal. See section 4.4. Then in section 4.4, warning and precaution for use, we can find the same statement then with the advice that patient with a recent history of pulmonary infiltrates or pneumonia may be at higher risk. Okay, that will warn the healthcare professional. The onset of pulmonary signs, such as now the symptoms can be the detection of this undesirable effect, such as cough, fever, dyspnea, in association with radiological signs of pulmonary infiltrate and deterioration of pulmonary function, maybe preliminary signs of the adult respiratory distress syndrome. Then that once again the connection between 4.8 and 4.4, and the advice done here is that the active substance should be discontinued and appropriate treatment given in these cases.
Excuse me, sir.
Yes.
Could you please finish it fast, sir?
Yes.
Okay.
Just a quick example about what we can find on packaging. Here in France, just because we have the so-called list 1 and list 2. List 1 is no renewable delivery and renewable delivery in list 2, and this frame with red border or green border. We can also mention some information regarding narcotic products, and here some restrictions about hospital use, hospital prescription, or initial hospital prescription, or specialist prescription only, and so on. Some symbols and pictogram we can find on packaging regarding the driving or using machine, and what's it's mandatory now is the pictogram of pregnancy with 2 or 3 different cases. And that was my last slide. Thank you for your attention.